Hey, it's Dr. Mark, and I'm here again with Vertiball, and today I want to talk to you runners or walkers out there who may be struggling with hip pain or pain going down the side of the leg. For some of you who might have researched it, you know that I'm probably talking about issues with your IT band or a muscle called the TFL. Now, these muscles or this fascia can be problematic if there's any type of change or differences with your gait. And specifically, what people often have problems with is if the hip opens up when you're running, the TFL or the IT band can become painful, and it can become quite painful for some of you longer distance runners. Some of the things that people have used in the past to help these are foam rollers or even those running sticks. Those are the sticks that have like the little plastic tubes that go in it that you can roll down your leg. Those are great, but there's problems or shortcomings with them in my opinion. The foam rollers are really hard to control and are often too painful, and the sticks are often not firm enough. So with the Vertiball, I think it's going to solve a lot of those problems and allows you to put as little pressure as you want or as much pressure as you want. And because it's so easy to use, I'd say make this part of your daily routine when you are a runner or a walker. So to use the Vertiball, you simply want to slip off the ball from the unit by pressing down. And then we want to open it up and we want to attach it. So I'm going to attach it to my drywall here, and I'm going to put it right about where my hip is going to be. Maybe if I find my front hip bone or my side thigh bone here, you want to feel your side thigh bone and just move a little bit to the front, and that's the proximate area where I want the ball to be. So I'm just going to put it against the wall. I'm going to drop the ball back into it, and now that it's nice and stable and firm on here, what I want to do is I want to try to get my hip lean against here. So kind of the magic area when we're talking about where the TFL or tensor fascia lata sits is kind of behind your front hip bone and kind of a little bit in front and above your side thigh bone. And that's where we want to start. So we can kind of lean against the wall, and we're going to take our leg and we want to kind of bring it across, and then we want to lean into the Vertiball, and we can kind of bring up our hips up and down. If we want to make it more intense, we simply kind of step a little bit further away from the wall and now support ourselves less with our arms. So we can really just lean in, and we want to come up and down. That's where the fibers of that muscle, that TFL, sits. When we want to work with the IT band, it's really long muscle that's going to go just down below the knee. And for that, we want to kind of work up and down. So we want to roll the ball up and down. Now, if you need to make it lower, we're simply going to unattach the unit, get it to drop down, reattach it, drop the ball back in, and now we can go a little bit down further against the leg. Again, if I want to make more pressure, I'm just going to get a little bit away from it and just put more weight against it. And then again, because that ball rolls in there, it's just going to be a nice roll all around in those areas. And you can make this part of your cool down routine when you're done your run or your walk. It can be a little intense, so if it is, just back off a little bit, or if you're one of those people who likes a little bit more of a firm contact, just lean a little bit more in. So with the Vertiball, and for those people who are suffering or struggling with IT band or TFL issues, I'd say give it a try. It works for the runners that I recommend it for, and hopefully it can help with you. Have a good day and good luck.